Hey guys, welcome to A Simple Aesthetics. I'm your host, Dr. Abraham. I'm here with Lindsey, who's back with us for another episode.
Thank you.
Thank you for coming back. And today we're talking about how to get snatched jawline, or what are some of the treatment options to kind of get that snatched forward face without losing fat or without taking away fat in that area. I think this is a topic that's, we had some people ask about it, and social media right now, you see a lot of these photos of the snatched jawline. A lot of people, I feel like, did not do their jawline or think too much of the jawline a few years back, and then as that thing kind of became more popular, it kind of just took off, and it became something that we kind of constantly hear about and people are asking about. So I think it's a topic that we can maybe dive a little bit deeper into.
Yes, definition in the jawline is so pretty. And it helps the neck, it helps the face look more contoured. And there's a number of options that we have for jawline.
Yeah, and we can talk about some of the different options. I think some of the first things that come to mind are going to be, dermal fillers. Those are used often, hyaluronic acid fillers. Also, you can use something like Redias, which is not technically a hyaluronic acid filler. It's still sometimes considered as a dermal filler, but it's a different type of product. But there are other options, including things like threads. You can sometimes even do a little neurotoxin in that area. You can do treatment like endolift, and there's even like treatments like RF microneedling. Some of these are gonna be more defining, like fillers or things like that. Whereas certain things like RF microneedling, they're not gonna give you necessarily that snatched jawline by themselves. They're more for skin improvement and skin tightening, but they can be a nice kind of like um, part of a package. Uh, they might play a role, but again, they're not by their own. They're not typically gonna be enough on their own to kind of give you that super snatched jawline. That's where something like filler might be a better option.
Yeah, I always explain it like there's kind of three parts to the puzzle, and it's really all over the face, but especially with the jawline. People notice the jowls, and there's all kinds of factors that contribute. But the three main parts of the puzzle are the bone structure. So we have our jaw bone here, the mandible. And as we age, that bone starts to shrink. The teeth steal calcium from it. The bone reabsorbs anyway, and you lose the structural support in the low face. So you can rebuild that bone basically with a dermal filler, Radius, or one of the hyaluronic acid kind of robust fillers to create a bony structure or create kind of an angle at the jawline. Men a lot of times look great with a dermal filler in the jawbone because you can kind of widen the jaw. It's like a really nice masculine appearance. Females, you don't want to really widen their jaw or create too strong of a jawbone, but you can kind of build off of the bone posteriorly to kind of just snatch the jaw line and create a little more pull and structure to lift the skin and help support everything above the bone. Then the second piece of the puzzle is the skin quality itself, which is a huge piece of the puzzle. And kind of you're seeing all the symptoms of skin laxity end up kind of in the jowl region and down into the neck. So if you can redirect the skin back up over the bone and hug the bone by firming the skin or strengthening the skin, that helps so much. Endolift is my favorite. And then I like to maintain endolift with like micro needling with radio frequency or some of the other lasers. But endolift, by far, I see such improvements on the jawline from one treatment a lot of times. So that one's a great option. And then the third piece of the puzzle is to kind of release the muscles that are like pulling down and weakening the sharpness of the low face. So the big platysma muscle in the neck kind of contracts out and downward and like drags the low face down. So if you release that contraction with neurotoxin, it kind of also will hug up against the bone. And just it's a tool in our toolbox to help sharpen everything up. And so those three things really help.
Awesome. And I think like a concept that I love, and I think we're kind of like you didn't mention directly, but you're kind of talking about is that a lot of time it's about knowing how the face, all the layers and all the parts of the face interact with each other and how to kind of address everything. Because sometimes people come in and they just, they've seen something on social media or something and they just think, like one thing is gonna fix the whole problem. But
Mm-hmm.
and there might be one treatment that for them, because as you mentioned, there's different pieces of the puzzle, but for somebody, it might be that the muscle is really what's causing, the place to start,
Mm-hmm.
whereas somebody else, it's more, the bone structure that's the place to start. That's where they're going to see the most improvement. But obviously, in a lot of people, if you can address all aspects, that's going to give you the optimal results. But it's about being able to kind of look at somebody's face and kind of realize that what's going on under the skin and how the
Yes.
different structure relate to each other, and even how the different parts of the face, like the jawline, relates to the cheeks, to their chin, and figure out, okay, what's the plan for that specific patient that's standing in front of me right now
Mm-hmm.
that makes sense for that patient. That might be very different from a different person who comes in who has different facial features and has, even though they're both coming in to snatch their jawline, the
Mm-hmm.
way we'd approach it is going to be very different.
Yes, absolutely. If someone is fairly heavy in the low face with more kind of subcutaneous fat or more like double chin, I would address them very differently than someone who's like very thin skin. And I didn't mention, but I also love PDO threads for the
Mm-hmm.
jawline. That again, I like to use as almost a follow up or a maintenance after endo lift, but on its own works amazing too. And before EndoLift existed, I did a ton of thread lifts. Same kind of idea. It's repositioning the skin kind of up back over the bone and suspending the fat layer higher in the face where it was prior. But that's a great option too for some snatching.
Absolutely. And sometimes people might be hearing this and initially somebody might feel overwhelmed because like, okay, so there's like all these five treatments, but that doesn't mean that everybody's gonna need all five
Yeah.
and at the same point. Now again, over time, it might make sense to do the different treatments because starting with one and then kind of going to the other one. As you mentioned, somebody might be really heavy,
Hmm.
meaning they have like a heavy double chin in terms of like extra fat there, so they might need to do something like kaibala or cool sculpting first, or like
Hmm.
lipo, something to kind of remove the extra fat to be able to work with the jawline. But somebody else might not have that issue, and you can kind of completely skip that part.
Exactly. And like you said, someone might be more deficient in one area than the other. So you just cater it to the person. But over their lifetime or over decades, you'll end up addressing most likely all the different depths of tissue that contribute and the different factors. And when people do that, they always end up yielding the best results. They always end up looking like themselves, just more youthful, rejuvenated, healthy. And when you try to kind of mimic some things that you might see online where they're just putting filler in certain areas, if you address just one kind of piece of the puzzle over and over again, like more and more filler over time, it never ends up looking as good as when you do kind of combine different modalities and kind of target different tissue
Yeah.
depths too.
And it really makes a lot of sense if you think about it, if you're listening to this, because as we age, it's not just one thing that changes. As you mentioned, our bone structure changes, the way our fat is positioned is going to change, our skin changes. And it's the combination of all of these things that make us, look the way we are. So if you want to, if we address all these things, we're going to have a more optimal result than if you only
Hmm.
address one thing and ignore the other, the other two. Um,
Yes.
and over time, again, maybe you start with one, or
Hmm.
there's one that's going to give you that's more relevant in a specific case, but overall
Hmm.
addressing the three. And that's, you know uh, it's very interesting what you also said about social media and stuff, and that's something we see where um, photos can be deceiving, a because of filters and stuff, but also b because of positioning. So like, you'll see somebody who just, let's say, try to address it with only like overdoing fillers when it's time to try to compensate for some of the other things that they're not doing.
Mm-hmm.
And then it's not gonna look good, or maybe in an image like it looks like it's super sharp, but then as soon as they open their mouth, you start to see the filler moving because
Mm-hmm.
it wasn't done to to replace what it was meant to do. It was done to
For a picture.
exactly. It was done for a picture. It was
Mm-hmm.
done to compensate for other issues that the filler isn't meant to compensate. And again, it might look like nice in the picture at a specific angle,
Mm-hmm.
but if this person starts to talk and move dynamically in the video, it won't look anywhere as natural.
Yes.
It just looks not natural at all.
I've seen a million photos online of like super snatched, very defined jawlines on a female. And yeah, in the picture, when they're kind of looking to the side, it does look very like, contoured and very sharp. But in real life, if a female is walking around with that sharp of a jawline, they actually will look very masculine or like very harsh. And so it's so true. Sometimes people think that it looks so nice in a photo or like from a certain angle, but in actuality, it might not look so natural or kind of feminine or aesthetically beautiful in real life when they're.
And as you mentioned, that concept you're talking about, the jawline specifically, but a lot of these concepts translate to other areas of the face, whether it's
Mhm.
cheeks or chin. By the way, just mentioning chin, a lot of time too, doing the chin can enhance the jawline, right?
Yes.
Because it's all kind of like continuous. Your jawline kind of goes into the chin. You
Mhm.
have the jowls, and then
Mhm.
um, if you fix the chin, if you fill where uh, that the marionette lines are, a
Mhm.
lot of time that can enhance that overall look too.
Yes. For a while, it was a little more trendy. It's still a practice, but people were removing their buccal fat, which is kind of like the jowl fat or the fat that you see in the low face. And there were a lot of people performing that procedure and a lot of like people out there getting the procedure to just remove that heaviness. And now what we're finding is that those people end up looking potentially less youthful when you take fat away. So now the understanding is to kind of preserve your fat because a youthful face has substantial fat in it. So if it's like, necessary to remove the buccal fat or a certain circumstance, that's perfectly reasonable. But for your everyday person, just to run and get a buccal fat removal might not always result in either a youthful appearance or like necessarily the optimal look.
Yeah, yeah, it all comes back to what you started with, which is understanding what the face looks like and what might one person needs might be different than the other person needs. So if you are, if you go and really based on your face, it makes sense to remove some of that fat. Then that's one thing. But if you're just trying to remove buccal fat because it's a trend and everybody's doing it and you're doing it without really you know uh, kind of analyzing or having somebody analyze your face and see what's really going to work for you, then that's where
Mm-hmm.
you're not going to get the outcome that you necessarily want.
Yes, I've seen multiple patients where it, like in their before photo, it looked like they had substantial buccal fat. But once we actually did their skin tightening, that quote buccal fat kind of disappeared because the skin reinforced, strength over top of the fat or kind of repositioned in a way that it relieved all that low face heaviness. So I always like to incorporate skin tightening if people want to sharpen the jowl, plus or minus the other options too.
I
Mhm.
know you mentioned endolift being one of your favorite treatment. Can you just kind of touch on it a little bit? What's
Yes.
endolift? How does it work?
Yes. So it's a skin tightening procedure. Depending on the person, you might repeat it, but a lot of people do one time and every maybe 3 to 5 years, depending on how you age or what your needs are. But basically, it's a very fine fiber that goes underneath the skin and gently heats the dermis to a degree that the dermis kind of shortens and contracts, and you get this instant tightening from all of the collagen contraction and the dermal contraction. And then over months from that gentle heat injury, the skin rebuilds itself and repairs itself from the procedure, and you get a lot of new collagen production too. So it shortens and tightens existing collagen and skin, and then it will produce a lot more collagen, which just helps the integrity of the skin, the firmness, and the elasticity. You can also use the fiber to melt unwanted fat, like say under the chin or in the neck. Occasionally it's on the face, but a lot of times it's underneath the jawbone, and that can very effectively sharpen up the jawline and snatch it. And for people who do want some fat removal, it works great, but it's a totally different kind of technique and procedure to do that. So you can do endolift and preserve all the fat in the face, or you can perform a different technique to get rid of some unwanted fat too.
And do you have to be like under like anesthesia for that, like full anesthesia?
It's as close to a surgical procedure that I perform without being surgery, but it's a very clean and sterile procedure to a degree, but the patients are awake and they just undergo localized numbing. So they don't feel the procedure. They come in, they can drive home afterwards. They swell for a few days, but it's tolerable. They can wear a wrap around their face to kind of help with swelling at home. And then you're kind of sore for up to some weeks, and then it resolves, and people see some instant effect like within the first month, and then over about 3 to 5 months you really see lifting and tightening. Especially when we look at pictures, the jawline is always so improved. By far one of my favorites.
Well, thank you for coming and for sharing your knowledge with us. Thank you guys for watching. Make sure you like, subscribe, leave us a 5-star review if you like this episode, and send us any questions, any topics you want us to discuss, and make sure you join us next week for the next episode.
Thank you.